Well, here we are. This is our time when we have our regular Tuesday morning COVID-19 briefing every week, but we're holding it here at LouVax to celebrate the remarkable success that has taken place here and the transition that's going to be going on to LouVax Mobile. And when we talk about success here, it could not have happened without these wonderful people that are sitting up here, that are part of Metro government and other super volunteers that have really helped organize this entire extravaganza that's been taking place here. So you all have been amazing, amazing citizens and colleagues, so really, really appreciate it. And I hope the media gives you all a little love out here. I want to recognize Dr. Sarah Moyer, who's with us here today, our Director of Public Health and Wellness, the city's Chief Health Strategist. So under your watch, Doc, a lot of good things have been happening here as we've been taking care of business here against the dastardly virus. And we've all seen how it's not worked out so well in some parts of the country and how some places have really taken it seriously and done as best as we could. And I'd certainly put Louisville in that category, and it's due in no small part to the great work of our Public Health and Wellness team, our Vaccination Distribution Task Force, which includes all of our hospital systems and our scientific advisors. It is a great partnership that we're transitioning here today. So when you think about that work and how it's impacted our city and the lives that have been saved throughout this, the legacy of the work that's taking place here is going to go far beyond the shot of hope that people have received. And when you think about the people that have been vaccinated here, so much of that have gone to our healthcare heroes, our first responders, our teachers, people who kind of use the protection that they got here to resume or continue their work in helping others. So we got a lot of leverage out of this site here today. And of course today, we've had a lot of shots come through here. Anybody have any idea on how many shots we've given here? Maybe 100,000, does that sound about right? So you'll be hearing more about that, but we're here today to celebrate. Today, 100,000 vaccines have been given through LouVax, which is just an incredible accomplishment by any standard. So again, just a tremendous job to the entire LouVax team. We want to celebrate the work that's happened here as we wind up operations at Broadbent and transition fully to LouVax Mobile. And we're making this transition in part because of the massive new vaccination site that's operated by the state at Cardinal Stadium, but also because we got to adapt our approach to the vaccination. We have got to go to where the people are, because clearly the massive demand at the beginning, people were happy to come to mass vaccination sites, but we're at a place with this vaccine effort right now where there's many people that are not as interested in getting the shot. So we want to make it as easy as possible by going into the community. We're already doing that in as many locations as possible so that it's safe to get the vaccine, because the vaccine is safe. It's fast and it's easy, it's accessible. And so the more we deploy into the community, the more we're going to see people take the vaccine, because it has slowed down. And we're very concerned about that, especially in the 20 to 40 year age category. That's where our biggest challenge is right now. The other benefit of going into the community is that people might be more comfortable, let's say, getting the vaccine at a local community center or at the church, as opposed to coming to a mass vaccination site like this. The same thing, we will take the lessons that we have learned here about logistics and delivery from this experience and apply those lessons to LouVax Mobile, as well as all the other efforts throughout our community as we get out in this vaccine effort. One thing that has just been accentuated time and time again, you can see it with my colleagues up here or the volunteers we have back here, is the importance of us realizing we're all in this together and taking care of each other. The numerous times that people have talked about just the feeling that they get here when they're helping to administer the vaccines, and to get that direct feedback from, your 82-year-old grandma that's coming through here and says, I've just gotten my second shot, and tears start falling from her eyes because of the relief that's come from that. And that, man, if you can't feel good about that, then, you need a slap in the face, because it's just been a really tough time for people to get through this. And so to see the relief from people getting vaccinated and see some vision perhaps of getting back to some normal, or just being able to hug your grandchild or go out to a meal with your friends. It's a really wonderful thing that's happened here to allow that to happen. So this notion of compassion, obviously, and caring for others has been fully at work, no matter if we're here or in the community. So we're in the final stretch also as I bring this into another topic around compassion. That's our Give a Day month of celebration now. We've gone from a day to a month, but it's been an incredible month of giving and compassion for us throughout our community. And we just got to keep this going as we think about adapting to volunteer work and doing that safely. It's necessary because our city is in a much better place in terms of new cases that we've got now compared to the past winter, but we have got a long way to go, and we've got to get that through. Some people are starting to take a victory lap, but we're not close to that right now. We are seeing very dangerous situations, especially in the northern part of America and then throughout Europe still, especially in India. The variants continue to mutate in more infectious and more deadly states, and if we do not take care of business here and get to herd immunity, those variants will be coming to our community as well, just as the introductory variants has also. So we have a lot of work to do. So let's keep getting that message out to people that we need everybody to get their vaccination on. Let's embed ourselves in the number. So for more on the latest COVID-19 numbers and the story of LouVax and the amazing people who've made it a success, I'd like to welcome Dr. Sarah Beth Hartland, our city's Associate Medical Director, and the leader who's overseen the operations here at LouVax. She is the first one to say, it's not about me, it's about us, and it's about everybody doing this together. So, Dr. Hartland, you've gone about this work with great humility and great leadership, and I would say great results as well. So just wonderful, wonderful job. Please welcome Dr. Hartland.
Thank you, Mayor, for that kind introduction. I'm going to steal Dr. Moyer's thunder today and give you the brief COVID update. Our incidence rate is now 12.44 cases per 100,000 of population, which places us in the orange category. We had 140 new cases and 2 new deaths last week. There are currently 79 patients hospitalized, 24 in the ICU, and 13 patients on ventilators. Across the area, we've given a total of 627,255 doses of COVID vaccines, which is about 367,000 primary doses, and about 259,000 folks have completed their 2-dose series. There's been a lot of talk in the vaccine world about the Janssen vaccine in the last week. The Janssen vaccine received a thorough review from the CDC's Advisory Committee on Immunization Practices, and in the end, they found 15 total cases of the blood clots of concern, which works out to a rate of about 1.9 cases per 1 million vaccines. I understand how scary these types of reactions can seem for people, but I want to emphasize that this is a great example of the scientific process working exactly the way it's supposed to. We have a robust system in place for identifying side effects from vaccines, and that process did its job. The experts reviewed all the available data, and we're happy to report that the blood clot issues are, in fact, as rare as we thought they were. As a health department, we have resumed using the Janssen vaccine in accordance with state and federal guidance, and having 3 vaccines available means that millions more people will be able to be vaccinated nationwide, and that they will be able to do so sooner. Vaccination is the path forward. This is the way that we end the pandemic. For Louisville, vaccination efforts have truly been a community effort. We've been lucky to have efficient collaboration between public and private institutions and to have a vaccine task force to help interpret and implement guidance. Here at LouVax in particular, vaccination is something that we have done together. As we complete our last few days of operations here at the arena, we're reflecting on the operation and celebrating an important milestone today. I told some members of my team this morning that I'm really glad that we're able to celebrate so we don't have time to be sad. It is a little bittersweet to be leaving this dusty arena behind here in a couple of days. This team has given 100,000 total doses, was 59,326 primaries, 40,627 boosters. Our patients have aged 16 to 99. We've served patients in 26 languages and on 7 modes of transportation: car, truck, van, bus, motorcycle, bicycle, and pedestrian. I am a little disappointed that we never got someone through on horseback. Over the course of this operation, we used 204 Sharpie markers, 480 clipboards, 600 safety vests, 100,000 Band-Aids, and 134,000 alcohol swabs. It's been a big effort. Our volunteers are the secret sauce to LouVax. They are the heart and soul of this operation, as I've said many times. Our total volunteer hours are now 76,074, with an estimated economic impact over $2 million. We've had 2,572 volunteers who have served, and they range in age from 18 to 84. We had 67 pharmacists, 138 physicians, and 478 nurses join us on the operational floor. I'm happy to say that we have now vaccinated over 1,000 volunteers. It's 1,087 in total. And it is truly incredible that we've been able to carry out an operation of this size with volunteer labor. Did you know that we train a new set of volunteers every 4 hours in this operation? So let's not forget, though, the Metro staff who bring that sense of leadership and continuity to the operation. We began this team with 3 team members meeting at a table in my office, and I see at least one of them up there. Hi, Paul. Over the course of the project, we've now had 112 total staff members representing 20 different Metro agencies. We have also, I'm proud to say, hired 13 new staff members, helping our community not only get vaccinated, but to get back to work. Many of those folks started out as volunteers, and we're so happy that they've been able to continue on as staff. We invited all of our staff back here to celebrate with us today, and I'm really pleased to see so many of them have chosen to do so. Looking forward a little bit, as more vaccine doses are given both locally, nationwide, and internationally, confidence in the vaccine continues to rise. At the same time, we are sort of nearing a tipping point where supply begins to exceed demand. Combined with the increased capacity of our healthcare partners like Norton Healthcare, University of Louisville, and Baptist Health, the time is right for the health department to pivot from mass vaccination to targeted events. LouVax Mobile has already held many successful events, and we continue to scale up and to have more. We're seeking to vaccinate those with the least access and those who are at the highest risk from COVID. Some of these events have been hosted by faith-based groups, community organizations, and others, but regardless of the host, LouVax Mobile proudly partners with Kentucky Nurses Association to bring vaccinations to the people wherever they are. I'm also happy that many of our wonderful volunteers here from the arena are continuing to work with us in our mobile missions. The LouVax team is not going away, and we hope to see all of you in your neighborhood soon. I believe we're going to hear from one of our nurses here in a second. So thank you, Mayor, for joining us on this wild ride at LouVax, and we're happy to be giving our 100,000th shot here in just a few moments.
Thank you, Dr. Hartland. Now, one of the highlights here, especially when we were early in LouVax, was the national attention we were getting as the national media was looking for best practices. So whether it was the Wall Street Journal or the New York Times that came through here and focused on the wonderful work of LouVax, it was really reaffirming to see. We knew we were doing good work. We didn't know we were amongst the best in the country on that. So that was a wonderful thing for our city. And one of the main reasons why this partnership has been so successful is the work that we're doing with our volunteers and, of course, our nurses. Our nurses have not just started this work when the vaccines were in place. Think back to February and March when the virus started coming into the country and how they've been on the front line and just fought through all of that 24/7 and all of the pain and suffering that was there and the sheer exhaustion that our nurses and doctors and everybody in our healthcare ecosystem, including our public health workers, were going through. And then the nurses was like, okay, well, now the vaccines are here. we're going to step up and do what we need to do in terms of taking care of our citizens and our patients with that. So there was no hesitation. The incredible heart and soul and minds that our nurses have has just been on full display for our city and the world to see throughout these whole vaccination efforts. And we're just incredibly, extraordinarily fortunate to have a great community of nurses on our side and outstanding leadership who the default answer for anything with our nurses and with Delnor Manson is yes. Whatever the challenge is, it's yes, we'll figure it out. We've got to figure it out because we need our people to be healthy. That's what we're here to do. So Delnor has just been an incredible leader as the CEO of the Kentucky Nurses Association, and she always has been, but I'm just really happy with the spotlight that's been able to be shown on all of our great nurses here throughout the vaccination efforts. So Delnor, we really appreciate you and your entire team, and Dr. Ruth Carrico as well. Please welcome Delnor Manson.
It is so good to be here this morning. First off, as Dr. Sarah Beth Hartland said, it's bittersweet that we are ending our time at LouVax. But then, as the mayor says, we're ready to go on to the next chapter. Nurses have been involved in this whole process since the pandemic hit. As you all know, 2020 was supposed to be the year of the nurse, but it got hijacked by the pandemic. So we now have 2021, who's also going to be the year of the nurse. The Kentucky Nurses Association, which represents and supports 90,000 nurses over the state, is, as the mayor said, always ready to support our community. And so we are participating and supporting the mobile mission process. And mobile missions are mini LouVax. All the same things that we need to utilize at LouVax, we need to utilize with the mobile missions. That includes logistics, supplies, volunteers, nurses, and all of the other goodwill and teamwork. It's just on a much smaller scale, but we must have it in order to make it work. Some additional challenges that come forward with the mobile missions include that every place we go, it's different. Here at LouVax, it's pretty stable. You know, we know cars come through, but when we do the mobile missions, we are going to the community, wherever they invite us. And so when we get there and we see the layout, then sometimes we have challenges. For instance, the different languages, or if we're dealing with people who have mental or physical challenges. These are things that make the mobile missions just a little bit more interesting, a little bit more exciting, but we get it done because the Kentucky Nurses Association is here to get it done. So we want to encourage people to continue to volunteer because we need you. And we certainly need those IT people, Trevin. So we need to make sure that they are still on board. Some of the things that the nurses have done, which is part of our DNA, is to provide education. To address the misconceptions, to make sure that we are finding out all the latest on the virus as well as the vaccines, because it's our responsibility as nurses to share that information with our family, our friends, the patients that come through, and their families. And with the mini mobile missions, let me just tell you, we're doing more than giving vaccines. We're providing that education, and we're actually supporting that community. We don't know the next time we may need to interface with those communities, and so building that trust with the mobile missions is part of what we need to do. Sometimes it requires us to slow down just a little bit so that we can do a little bit extra to build that trust. Vaccine confidence is a challenge, but we're up to it. And part of that is listening and answering those questions. And remember that that's somebody's sister, that's somebody's mother, that's somebody's father or brother that we are establishing the relationship with that may help us the next time we need to get to that community. We also are responsible for making sure that people who are getting that information have resources, making sure that they know how to get to the CDC website, how to get to the the Metro Public Health website and the FDA, and that they can use those as trusted information sources. And we need to be able to share that on a regular basis. Oh, one of the other things that is extremely important, especially with the mobile missions, is vaccine safety. And nurses are responsible when they're giving those medications to make sure that we're doing the right doses and that the vaccines are safe. And so one of the things I'd like to say is thank you for allowing the KNA to participate, to allow us to be at the table while decisions are being made, and also to help get it done. And I want to say thank you to Dr. Ruth Carrico, who couldn't be with us today, but as you can see, we couldn't do it without her. She was integral in the development and putting together the LouVax based on some of her other mobile activities. So thank you, Ruth. Everybody get that? Thank you, Ruth.
When we started getting the vaccine and people said, okay, how are we going to administer this to folks? You know, a lot of people don't have a lot of trust in government these days. And for the city of Louisville to see how our public health team and all of our other associated team members and volunteers responded to this challenge and have been amongst the leading cities in the country in terms of vaccination and education. You all did it, you know, just one person at a time, 1 hour at a time. And when you start off on a huge project like this, it looks like it's almost undoable because it's so big. But here we are 100,000 vaccines later and several 100,000 vaccines throughout the entire city. And I think you all just really made the city of Louisville proud and are making us proud with the work that we've done. And you've done a great job as Metro employees, and I just want to really thank you from the bottom of my heart, showing people what good government looks like. So great job to you guys. And so I think we're going to reposition here, right, in a moment, and if there's any questions before then, we'll be happy to take them. The last day of shots is tomorrow. No, it's Thursday. Last day of shots is Thursday. Last appointment is 4:15 on Thursday, and then Friday is going to be a cleanup and tear down day. And then LouVax Mobile's already into the field, so scaling up even more.
Probably a question for Dr. Hartland, but and I don't know the validity of this, but I've had a couple people reach out saying that they were scheduled to have their second dose here on April 30th. What should they do if that is the case? What should they do, or if that's not the case, but they can't make it for some reason? What should they do?
So for people who may have been scheduled after April the 29th, which is our last day of operation, I believe we've reached out to all of those people to get them scheduled, to help them move into, we're accommodating them in the next couple days. For those who are not able to get through that, to get through here in the next 2 days, we do have partnerships with U of L at Cardinal Stadium and other sites across the city. Our helpline can help folks get connected with the right site for whatever vaccine they have to get their booster. Anybody else? So the question is about the response from organizations or businesses who are interested in hosting mobile missions. We've heard a broad range of our community, many community organizations, but also some retail places, some restaurants, things like that, some of which are already on our schedule now to scale up, but others are we're still in the process of working with. So we did hear from quite a few, and I'm also going to put the call out again that we're looking to hear from you. If you are in an area with, let's say, 20 or more people who you think need to be vaccinated and you think we need to come to you, reach out to us. You can email us at louvvaxmobile@louisvilleky.gov, and one of our team will get back with you to talk about the specifics.
We are celebrating our 100,000th vaccination.